want, why don't we just kind of get started at the beginning here? So, everyone, this is Natalie. She is with Aesthetic Management Partners, and she is going to be uh, kind of getting us started on the slides, and we'll kind of be going through this together. Feel free during the time, if you have any questions, you can put them into the chat menu, and we may answer them then, or we may just kind of wait till the end to go through those. But we are going to get started here. So, welcome, everyone.
Thank you. Yes, so my name is Natalie Rojas, and I am with Aesthetic Management Partners, and we are a regenerative medicine company that really is on taking a natural approach to aesthetics. So thank you all for giving us some time out of your evening tonight, and we were going to be learning all about Salinus Derma PRP. So just a little bit of an agenda this evening, what we're going to be going over. So what is Salinus Derma PRP? What does it do? How does it work? And what are the results? Then we will be going over some really great results of what we're able to achieve with this natural product. And once again, we'll have a little session for Q&A. But like Dr. Sohayda mentioned, please go ahead, put questions into the chat just so we can compile them, answer them. Then feel free to come off mute and we can really make this conversational. We will then be going over how to schedule the event consultations because at the very end, we are going to be going over some event-only pricing for attending the event this evening, learning all about Derma and how you can take advantage of that. And forgive me, my screen's on this side, so you may just see the side of my face. Okay, so what is Salinus Derma PRP? Derma PRP is a natural volumizer. We're able to not only add volume with this natural product, but we're able to support skin revitalization by incorporating your own growth factors to increase production of elastin and collagen. And then in turn, when that volume is injected, as that volume is beginning to decrease, those PRP benefits really start to kick in. And that's why we are noticing the improvement in skin texture, skin tone, and overall natural glow. This is a survey done by the Aesthetic Surgery Journal, and what this is saying is exactly what we mentioned. People are wanting to invest in their appearance. They are wanting to look refreshed. They're wanting that youthful glow. But within aesthetics, there may be some concerns that have come with recent trends just within with certain aesthetic treatments, specifically when it comes to adding volume to the face. Some of those concerns are going to be safety and efficacy, right? We all want something that's safe. Looking unnatural is a very large concern. So we're wanting to look like ourselves. Everybody wants to look like themselves, but really just turning that clock back and being able to look refreshed, looking like we just went on vacation and slept for 2 weeks, but waking up like that every single morning. And then also synthetic materials. So having a natural option. This is also going to be for patients that may not be able to take advantage of some aesthetic treatments due to health concerns. So having a natural option is just another avenue to be able to address some of those aesthetic concerns with being able to achieve correction and prevention. And then cost. So we all want something that's safe, we all want something that works, but we want it to be cost effective. So this is an influencer. She is famous for being on Teen Mom, and feel free to come off mute. How old do we think that this celebrity is? Feel free to put in the chat. So this celebrity is actually 29 years old. Within some of the aesthetic trends, this is a main concern with patients of, chasing that volume, doing treatments and really making patients look older by being overfilled. So with Salinus Derma, we know that this product is and the treatment protocol is going to be able to achieve a natural looking result, but still being able to achieve the volume and the skin health. So why Salinus Derma PRP? So Salinus Derma PRP is a natural Volumizer. It's going to help support the skin's revitalization. It's going to help increase collagen, improve skin texture, and improve the skin tone. And it's going to be completely natural. It's quick, it's very comfortable, and it's going to be cost effective. So more bang for your buck. Because this product is made from your own blood, we're using your own PRP. So that's your platelet-rich plasma. By doing this, we are able to produce more product. We really create this product. And so we're able to have more product to be able to achieve whichever correction or prevention concerns you have, and it being more cost effective than some other volumizing treatments. It's safe and effective on all skin types. So Dr. Sohayda has chosen the most peer-reviewed, the most studied, and the most used tube in the world for PRP. So we know the safety, we know the efficacy of this. It's sterile. We know that it's safe to reintroduce to the body because it's made from your body. There's no risk for any allergic reaction. So once again, being able to even address and treat autoimmune compromised patients, knowing that we are going to do that safely. And then it's a great complement to enhance any other treatments that you may be doing now that you may be interested in. So let's say that you just started your RF microneedling treatments at Essex. And now we know that by adding Derma, we are not only going to improve the results of the volume side of things, but we're going to be able to improve the results of any other aesthetic treatment that you are currently receiving or looking into. So it complements well with everything. Great to combo. And then also the extended reabsorption rate. So we know that this is long lasting. With it being a natural product, there are other treatments out there that may not last as long with being created from your own body. We know that with Selenus Derma PRP, we get the longevity of the volume, and then in turn, with the skin health benefits, we're not having to continue to fill to the same amount to be able to achieve that result because the skin's overall health, the laxity are all improving as well once we receive Derma. So popular applications, because this is such a safe product, we're really able to put it anywhere. So we can treat multiple areas. We can treat face. We can even address creative areas. The first place that we show age is definitely going to be neck and hands. We can treat the neck, the hands. We can even address any scarring from acne or any other scar on the body. We can address cellulite as well. And with it being with the treatment, you receive so much product that we're able to create that we can address multiple areas within one treatment and have enough product to be able to address all the concerns. So how does Selenus Derma PRP work? How do we create it? So it's typically about an hour and a half treatment. You'll come in, and one thing that we'll have you do as homework is come in very, very hydrated. So once you come in with your completed hydration assignment, then we will do a blood draw, and then we are going to spin your blood. This separates everything, and we then receive our PPP and our PRP within our tube. We are going to remove your PPP, which is your platelet poor plasma, and we are actually going to heat it and then cool it. So think of a scrambled egg, think of a raw egg going to a scrambled egg. By doing this, we create this gel-like viscosity that we're able to use as a filler. But then we mix it with your PRP, which is going to house all of your growth factors, all of those platelets that then deliver the skin health revitalization portion of the treatment. And we are going to use that as a volumizer. So here's a quick video of just so you can see the consistency of it. And this is all created from your own blood. So you can see the lasting volume there, and we really are able to achieve great within, if you were looking to like restructure, if we are looking to do full facial balancing, if we're looking to add any deficits, we can wrinkle chase with it. It has a great structure and it's long lasting for up to 9 months. And then when we layer the treatments, just as we do with many other aesthetic treatments, we get the benefits for longer. So treatment expectations. We always recommend 2 treatments for derma just to really layer everything and make sure that we've achieved the look that we would like. And then we do numb, so it's very, very comfortable. And the process is about 30 minutes to prepare it. So you will be in the office for about an hour and a half, with the injection portion being not, you're not going to be being injected that entire time. It just takes some time to create the product. And then we like to recommend anywhere between 45 to 60 days in between those 2 sessions. Post-treatment, minimal downtime. With it being a PRP product, there's going to be minimal bruising and then also less injection sites. And then immediately after, you will see that volume. And then around the 3 to 4 month mark is when that PRP effect really comes into play. And you notice that you have your derma glow. And it only continues to improve. Okay, so what are we talking about? What does this look like? We're going to go over some before and afters, and I'm going to pass this to Dr. Sohayda.
Okay, thank you, Natalie.
Yes.
So this client is a client I've actually known for years, and she's had some other skincare treatments done, including RF microneedling, which again did help a little bit with her skin tightening, but she still needed that volume replacement. Because for all of us, what ends up happening over time is that we start losing volume in the mid face first, which is not only soft tissue, but it is also bony structure. And we want to try to recreate that, but we want it to look natural. So we want to start in that mid face and then kind of address the lower face as we go down. So with her, what we had done after she had her RF microneedling, we did 2 sessions of the Derma PRP, and this is after her second session. And you can see if you look in her mid face, underneath the eyes, and also what I call kind of an extended tear trough area. If you look on the first picture, she has a little bit more of this hollowness kind of in her cheek area that kind of extends down both cheeks. So what we did is we filled that back in. And when you do that, it actually gives you a little bit of a lifting effect in the face overall. It also helps to recreate what we call the apple of your cheek, and it just makes you look more well rested. The other thing that it'll also do is it supports the structures underneath the eyes so you don't look as tired. Natalie and I were just having this conversation that sometimes people talk about doing under eye filler. And there's a couple ways of doing that. You can treat just the tear trough, but actually what works better is if you support those structures in the mid face and that cheek area, it really gives you a lifting effect and it gives you a brighter under eye appearance. The other thing you'll notice on her too is if you look down in the marionette area, she still has some lines on the picture on the right, but you can see where these things have really smoothed out. And the other thing we can do too is to soften out the jawline a little bit over time. Now, she could still stand to have one more treatment done. We notice that in that marionette area, as you lose volume, and again, that is soft tissue and bony structure that you're losing down in that area, we tend to get a scalloped appearance, so the chin looks a little more prominent. Then you get this indentation in the marionette area, and then you get the jowling. So we can also do facial contouring again to help soften out that, if you want to say kind of that scalloped appearance they get along the jawline. So even with the treatment we did here, you can see that she's gotten some softening of those changes. And it also has brought up the corners of her mouth a little bit. So there's a lot of things that we can really do with this. On her, we did not do her lips. You can do lips. And with the lips, with Derma PRP, you will get an improved volume. It is not necessarily something that's going to give you more, I call it the show of the red or the red show on the lips. But it does a really good job for all the fine lines around the mouth. So people that have smokers lines, and a lot of us get those, it's not just because you're a smoker, it's because we smile and we purse our lips and all that kind of fun stuff. But we can really go in and go after those individual lines. It's a very soft, natural appearance. And sometimes one of the benefits of this versus doing regular fillers, sometimes if you use regular fillers or I would say if you don't use the right type of regular filler, you can almost get a little bit of a bulge or a ridge rather than an indentation from those lines. And Derma PRP does a great job at softening out those lines and making it look very natural. The other great benefit well, there's two really other big comparisons compared to regular fillers. As Natalie was saying, is you're going to see some volumization with this right away. But your body over time, because this is a natural substance, some of this is going to break down, and that's natural. That happens even with regular fillers. But the nice thing of it is, as some of that volume is decreasing, that PRP that's in there is kind of like fertilizer for your skin. It's rebuilding those structures. It's helping your body do the work. So that's going to start to kick in. And the benefit of that PRP that you don't get from regular fillers is it actually is providing nutrients for the surface of the skin. It makes your skin look much more healthy. It has a better, if you would, a better color tone to it, but just the radiance and the luster that you have in your skin is much better after doing this treatment. And I think you can definitely see that on the cheeks in this photo.
Definitely.
And again, on her, we did not do her neck, but you certainly can also do the neck area with this as well. All right, and now this is a person that I'm trying to think if she ever really had much of anything else done, but she really didn't like this fatigue underneath her eyes. And this was actually just after one session. But again, that's kind of the same thing. You can really see we started up in the cheek area and the hollow underneath her eyes on both sides is much less. Even some of those lines are less noticeable. And if you look again at the corners of the mouth, there's some softening of those lines. But her skin in general, it's the quality of her skin, it's the tone of her skin looks much better because of the Derma PRP. We did go on to do another treatment for this client as well. Unfortunately, I didn't put it in this slide, but she continued to get better volume improvement with this. And you can also see again, it just helps. There's something about, I tell people it's the way the light reflects off your cheeks. When you have the proper volume in your upper cheek, it makes you look much more well rested. And again, I can definitely see that in this picture.
Yes. No,
Now,
so this is
yeah, this is one you can go ahead and talk about this one, Natalie.
Yes, so this is going to be, we used the full facial balancing technique for this patient, and this is one treatment. So when we have the two options of the treatment, I always recommend going with the full facial balancing or like the larger area treatment, which is the 22 ml. And we'll go over the difference in options for derma. But this provides so much product that we really are able to come in and address everything that she was pointing at, and it gives us so much more to work with. And so, in my opinion, like she looked like she had even something like surgery done with this. But this is going to be 4 days after her first treatment, and you can already see that her skin is glowing. And where they were able to address is really just the facial balancing. So she looks like herself. It just looks like the clock was turned back quite a few years, and then she looks brighter. She has that derma glow to her.
Yeah, and I'd have to say on that one, she definitely looks like, if I didn't know any better, I would have thought that she actually had a facelift with that
Yes.
one. Yeah.
Mhm. Here's an example of how we can use derma to really structure. So for her name is Alice, And we really focused just on lifting the apple of her cheek. So we focused on pulling this up and then addressing this jawline for her. So she wanted a more structured look. So yes, Derma is great for even using it for treatments that we typically would use, like a traditional HA filler, but it still has that substance to it that we can sculpt with. So you can see the difference here and then up here on her cheek of just how we were able to lift. And by applying it in the mid face, she even got some lift around the corner of her lips.
Yeah, and again, I think that's a great picture on that one because she's in both these pictures, she's actually a very, very attractive lady, but she just needed a little bit more, again, kind of on that apple of the cheek. And just by doing that little bit, it makes it, it definitely changes her profile. I apologize about that. It changes her profile, but it still looks very, very natural. So,
Mhm. Men love this treatment. This is going to be, so call your husbands, your brothers. Men love derma because the last thing that men want to be asked if they're at work or, on the golf course is, what did you have done? Not what are you doing? Like, so with this one, he looks younger, his skin is brighter, and he's not going to be questioned on what type of treatments he's received because he still looks very, very natural. But they can tell, are you resting? Are you getting more sleep? What type of vitamins are you taking? Because you look refreshed. So this
yeah.
is a great treatment for men.
Yeah, and I notice on his too, if you look at that again, that tear trough that comes down and kind of extends down on the cheek, you definitely don't see it nearly as prominent on the after picture.
Mhm. So this is going to be this is two treatments, and this is at 9 months post two treatments. And what this patient was really worried about, and you can really see it in this side profile, was just the hollowness that she was feeling with under the eyes and around her mid face, and almost feeling like she was just losing so much volume that she felt like she needed to pull back. But what we really needed to do is just address those areas with that deficit of where she lost the volume and we were able to get that youthful glow back. This is another example of how by placing derma in the correct areas, we can even get the slimming technique, the slimming effect, but we're adding volume. So adding it in the right areas and within that mid face, having some lift within the parentheses and around the little marionette lines, and her face looks slimmer just by adding the derma in the correct areas in that mid face.
Yeah, and what I would say on this too is that over time, so if you look at her picture on the upper on the right, it has a little bit more of a V shape. What ends up happening with time, because everything from the mid face, you lose that volume and then the skin starts to get more full and you get fullness down on the jawline, it creates an inverted V, or what we say is more of an A shape. And so the again, the more well-rested appearance is when we put that volume back in the cheeks, it gives you the lift and then it recreates that V shape that you see on that second picture.
So this picture is actually to speak to the longevity of derma. This is a patient out of Denver, and she is a triathlete. And myself, I can be a horrible patient sometimes where I don't need, I'm supposed to get two, but I get one. And this one, she came for one treatment, and we suggested two. With life, she only made it for one treatment, but she came back 9 months later to get her second session. And with her lifestyle, with her metabolism, her working out and training for triathlons every single day, you can see that the derma effects are still there. And she still has that volume that we place strategically to be able to get some of that lift within those parenthesis lines. And even just the glow with under her eyes, those PRP effects, the overall skin health, she still has more of a glow and a youthful look within that one session 9 months later. So this is one of my favorite pictures. This was done with the more targeted area, and we really just focused on mid face. But this is immediately after, so you can see it's minimal downtime, minimal bruising, and we were able to really get her glowing within that first treatment. And then also just she looks so much younger, but she still looks exactly like herself. She looks like her. She looks very, very natural. She looks like we just turned the clock back. So we were able to address the mid face and then also around the lips. So we did those straw lines as well. And then we were even able to address those parenthesis lines over here. And this is an example of using it for around the lips. And then we did a little bit just in the border. But this is going to be 30 days post-treatment when she came in for her second session. And you can see, even though we did not put any in the lips, around the lips with the PRP benefits and the growth factors, the skin is more hydrated. And so the lips can look more youthful, even though we were not adding volume to the lips because of all of the PRP benefits. So this one we did use for volume. Unfortunately, this patient was never able to take advantage of using a typical HA filler just because of some medical concerns. And so we can get volume with Derma, but as you can see around the mouth, we don't have that risk of the filler moving back after time, how your body's metabolizing that, because that's going to be person dependent. And then around the lips, we can even see that the skin health is just it's a wrinkle chaser. We can wrinkle erase with this, but then as that volume's decreasing, we're noticing the collagen and the elastin kicking in, and we're able to achieve an overall youthful look even as that volume begins to dissipate. Especially over here, where she had the corners of the mouth were almost turning down, we were able to perk that right back up. Neck. So like I mentioned, neck and hands are typically the first place that we show age, especially nowadays with everybody, even younger generations. We're all like this. We're all looking down at our phone. We're constantly creating those little neck creases. Tech neck is a thing, and so we are able to address the any of the lines within the neck, and by adding that volume in there, we're also going to address the elasticity. And so she almost looks like she got like a little ponytail lift because we were able to address the elasticity and the collagen building of the area on the neck. So wrinkle erased, and then also got the lifting effect.
Yeah, and I would say, Natalie, on this one too, one thing I'd like to tell people is that for the neck area, they did for a while try to use some traditional fillers for the tech necklines. It never looked that great. And then there was another product that came around that it's a PLA, and it did okay, but the problem of it is the neck it's very fibrous, and so it was easy for people to get nodules from some of those products. The nice thing about Derma PRP is we actually have control over the viscosity, or if you want to say how thick or thin the product is that we put in there. But because Derma PRP by itself, anyhow, is so natural and it's so supple when we use it, it blends very, very well with your native tissues. And in this picture, you can kind of see in the center where she has some of these other little lines that are coming down. Much better on the second picture. The tech necklines are better, but in that center area, some people I call it the crepiness in the skin of the neck. Because Derma PRP is very hydrating and very natural, it not only helps those tech neck lines, but it really helps the quality of the skin. And you get rid of that, like I said, kind of that crepiness that women tend to get right in the center of the neck area. So again, of all the products and options that you have out there, this is probably one of the best ones. Now, it may not be a bad idea at times to do some resurfacing of the skin as well. But the combination of that Derma PRP with maybe a little resurfacing will make a huge difference on the neck. And again, necks and hands are usually where women notice it first. So,
Here's another example of neck, just decreasing those lines. This is immediately after. So with the amount of product that we're able to create from your own blood, you can see that we had enough to even address her lower face, around her mouth, and her neck. So very cost effective when looking at multiple areas. Derma PRP can also be used for scars. So not only are we diminishing the appearance of any indent of a scar or wanting to pop out for volume, but you can notice that in the scars that were treated for that deficit, it's going to improve the skin health and the appearance, the tonality and the texture of the scar itself. Here's another example of a scar that we treated.
Yeah, that's a huge difference. Do you know how many treatments they did on this? Was this
This was two sessions of an 11 ml.
okay.
So
Okay.
two treatments, and this is at 60 days post second treatment. So right at that like 4 month mark where the PRP effects are very heightened and then continue. Hands. Back of hands is actually predicted to be one of the top areas to receive aesthetic treatments in the next couple years. And so we're able to get that youthful volume back on the back of the hands. Very, very safe, very comfortable, and no downtime. Here's another picture of hands. And then cellulite. Cellulite's been a tricky one. So with cellulite, what we're doing is we're really just going after we're dimple chasing. We're popping out any dimples. And then once again, the PRP effects come in to help tighten the area, to boost the collagen production in the area. So then going forward, as we're losing that volume, the appearance of the cellulite is definitely diminished for more than